a specialist doctor to take care of your concerns. Guys, every week we invite eminent doctors from different specialties based on your feedbacks and messages that we receive on our WhatsApp platform. This free of cost WhatsApp platform is there on our website Cureka.com, and we get thousands of messages per day from multiple people talking about their concerns. They want to know about how to use a certain product. They want to know about product recommendations, and in these messages we get to understand how beneficial these live sessions are and how you are able to make the best use of them by getting the knowledge on the topics that you want to get. So today, the doctor that is going to be joined by in this session is Dr. Vibu Krishnan, and he's an orthopedic surgeon at prestigious Devadas Hospital in Madurai. So let me welcome on board Dr. Vibu Krishnan, and we are going to talk about the topic of occupational neck discomfort. It's a very common topic, and a lot of people, including myself, we have been worried about and facing discomfort in neck because we have to sit every day. So let's discuss with Dr. Vibu and take much of his time. Hi, good morning, Dr. Vibu. How are you?
Great. How are you doing? Thanks for involving me in this program today.
Thank you so much for joining us, Doctor. Are you able to hear me?
Yeah, I can hear you clearly. Thank you.
Am I audible, Doctor?
Yeah, you are. Can
Great.
you hear
great.
me?
Yes, I can hear you, Doctor. I can hear you very well. So, Doctor, today we are going to talk on a very interesting topic, occupational neck discomfort, a concise guide to a pain-free workday. So it's a very much asked about topic in our different chats and different messages that we get from our customers. A lot of people are working professionals, even businessmen. They have to sit throughout the day, and it becomes really difficult for people, especially the ones who are sitting in front of a computer or a screen, to have that neck discomfort. So we're going to cover a lot of topics. So the first question that I have from our listeners is, what are the common occupations or professions, doctor, that are prone to causing neck pain, and why so?
Yeah. First, thank you for this opportunity to join you today. As you said, it's an interesting discussion. The first question put forth is very relevant. So basically, neck pain is something that most of us experience at some point in our life, and being one of the commonly used joints, neck as a whole is considered a joint. It's being one of the most commonly used joints. Most of our activities, day-to-day activities, especially at our jobs, because there we need to sustain a particular activity for at least 8 to 9 hours during the majority of our day time. Most of our jobs do involve a significant stress on the neck. So commonly, the neck pain is seen in people with desktop jobs more commonly. The commonest would be the people who work on systems for long hours, be it IT professionals, software engineers, be it people in the accounting, or those who may need to use either sit with a laptop or a desktop for a long time. So that leads to fatigue pain, and that's one of the commonest occupations which lead to neck distress or neck discomfort. Apart from that, sustained activities which require us looking up for long hours, or looking down for long hours. So doctors themselves do have a significant proportion of professionals who do have may need to bend forward for a lot of activities, especially dentists, ophthalmologists. So they do have this as common as hazard associated with their occupation. In addition, people, teachers in teaching jobs, or who may need to use blackboards for long hours. Even people, plumbers or electricians, or people who need to look up or have more of over head activities. They do have a lot of neck discomfort over time. Additionally, neck. Interestingly, the neck and the shoulder do share the trapezius muscle, which is very is one of the commonest muscles to get inflamed, both due to neck and shoulder pathology. So a lot of times, people who do a lot of overhead shoulder activities, lifting things, so they may also have neck pain. So there are a wide variety of occupations where neck pain is commonly seen, but a big proportion of these patients usually are, as I said initially, people who sit with software, the desk or a laptop for long hours. So
Right. Doctor, we are facing some challenges with respect to your mobile network. Can you please get it checked? I mean, your voice is breaking a lot in between. We are hardly able to hear you. Yeah. So, okay, so let's move on to the next question in between. So, we have understood like what are the common occupations and what are the reasons that you have shared in depth now. But how has the rise of remote work affected the incidence of neck pain? A lot of people are working from home these days. So how has that contributed to the neck pain, and what can individuals do to mitigate these challenges?
yeah, work from home is something which is commonly prevalent in today's world, especially after the pandemic. The a lot of times the ergonomically the seats and the the tables in the offices, they have been organized. But when we do work from home, we need to take care of. We do tend to sit in our usual relaxed postures, where maybe in a sofa or in our beds. As we used to watch television or used to relax, so we tend to use our laptops in such positions.
Hi, it seems that there is an internet issue at the doctor's end. I'm sure Dr. Vibu will be back very, very soon. So, in the meantime, guys, I'm sure that you are logging on to Cureka.com for all your healthcare needs. We have got products from 9 different categories, guys. Products from skincare, hair care, nutrition, maternity care, baby care, sexual wellness, elderly care, pain management, herbal and Ayurveda, and we have got phenomenal number of healthcare devices, eye vision devices, products for prostrate, products for UTI, adult incontinence, multiple healthcare products to take care of different concerns and help people lead a very healthy life. So give us an opportunity. Do check out Cureka.com and let us know which product would you like to know more about. You can send us a message on WhatsApp platform. That is our free of cost WhatsApp platform. And our care team experts will get in touch with our doctors, in-house doctors, and try to get you a solution for your concern. And this is absolutely free. There is no cost for the WhatsApp platform. You can ask as many questions, clarify your doubts, and we'll be able to help you. We'll be more than happy to help you guys. Also, we on time to time we keep on adding more brands, and if there is any specific brand, and it's very heartening to know that many times we get WhatsApp from people saying that this particular product is what I want to buy, but I don't have it on website. So can you please add it on website? So heartening to know that you want to, buy from us, and you share a lot of feedbacks. All those feedbacks are, well noted, well taken, and within, very, very less time, like typically 24 to 48 hours, we update those products on our website based on your feedback. So guys, do check out Cureka.com. We've got many New Year offers going on, and let us know which product you would like to buy and give us an opportunity to serve you. So yeah, Dr. Vibu is back. So hi, Dr. Vibu. Yeah. So we were talking about remote work and how that has impacted, the neck pain of people.
Yeah, I'm sorry that I lost you.
No worries.
So as you said, it's a common concern, especially at the pandemic. After the pandemic, we ergonomically the seats and the tables in the offices may be better equipped to handle work for long hours. But when we work at home, first the work from home, the first concern is that we may not be um, we may be working at odd hours unlike what happens usually in the office setting. Very late in the nights, very early in the morning. So the first of all, the rhythm, there's a substantial change in the pattern of work and the time of work. Secondly, the positions, again, we may not be sitting in good seats or comfortable postures. The postures actually play an important role in terms of the neck pain or pain anywhere in the spine. So that's the second thing that we may not be giving sufficient importance to, especially when we are working from home. And again, we may be using sitting on our beds or on comfy sofas with the laptop, and we may be putting our neck to unusual bending or extending positions, which again can cause a lot of stress to the neck. So in general, what causes the neck pain is more instead of it's not a single injury or a trauma that causes neck pain. It's more like a fatigue pain that happens, especially when a certain unusual or an uncomfortable posture is persisted with for a long time. So that's when the muscles and the soft tissues around the neck and the neck bones, they actually fatigue, and that leads to pain, which when not addressed upon at the right time can continue as a chronic pain. So this as the impact, as I just mentioned, after the concept of work from home has become more prevalent, is that the neck pain prevalence has definitely shown, at least anecdotally, has shown a progressive rise.
Right. Thank you for sharing that, doctor. Moving on, we have got another question from our listeners. In what ways can ergonomic office setups contribute to reducing neck pain because of prolonged computer use?
Yeah. So as I said, that's one of the advantages, of having a good setup, either in the office or at even at home settings. This definitely plays an important role in terms of getting us comfortable with regard to the neck related issues. So in general, with regard to the neck health, the as we call the postures that we recommend are a comfortable chair or a seat which is fairly upright, maybe 5 degree at the most, reclining backwards, but the support preferably goes on at least beyond the neck, possibly up to the back of the head, and there is it's reasonably cushioned. It's not too soft or too hard, and at the same time, there is a support on either side for the elbows, so that the elbows can be placed without too much of pushing up of the shoulders or too much of drooping of the shoulders. So the elbow rest on either side should be at the right level. And apart from this, these are the things regarding the chair. And apart from this, as we said, for the neck, it's not good to bend too much or bend too much forward or even upward. So ideally, the either the paperwork or the system work that we do, it's fairly at the eye level, so that the neck is not strained in unusual postures for a long time. So when we when we do have a keyboard in front, so again that should be at the right level so that the elbow the elbow also rests on its appropriate support. So overall, there should be a good support of the neck. There should be a good support of the elbow, and the table or whatever we have, the desk that we have in front of us should be at the right level so that the neck is not too bent forward or bent backward. These are the things. So such a position can definitely help substantially in regard to mitigating our risks of developing neck pain over long years.
And when we talk about ergonomics, doctor, I mean, how important is to take breaks, sitting for a long time, and then that would always contribute to some sort of a discomfort or some sort of pain. How important, and when should one consider taking a break from
Yeah,
sitting?
that's an excellent point raised. As I said, this is all concerning muscles. I would say each person is different. Each body habitus is different. So instead of setting up a guideline for everybody, I would say it's reasonable to take break at reasonable times. By reasonable, I mean that concerned person should not feel discomfort after a certain point of time. So that may be 30 minutes for one, that may be 45 minutes for one. I would say it's unusual for a person to be comfortable beyond an hour in the same posture. So maybe at around 30 minutes or 45 minutes, it's reasonable, especially for people who need to sit at the same position on desktop jobs to take a break and then possibly just go around, possibly relax their neck muscles, and then possibly have some shoulder shrugs, make themselves comfortable, and then get back to the position. And again, if they may prefer to sit in a different seat for the next session of maybe the 30 or 45 minutes, and then get back to this. So some constant change definitely helps the muscles to relax in different positions, and these breaks are of utmost importance.
Right, right. Thank you so much, doctor, for sharing that. Now, doctor, a lot of people are already like suffering from some neck-related issues like cervical, right? And but they have to again sit for long hours in front of computers, whether at home or in office. So, what is your recommendation for them? People who are already having neck pain or cervical issues. What should they do to mitigate these pains?
Yeah. So first of all, it depends on how severe the discomfort is. I would say if it is really severe, then I mean in terms of severe pain, there may be very severe arthritis or large discs which may be pressing upon the nerve. So in such situations, it's better to get a medical consultation at the right time. But in fatigue or moderate to mild kind of pain, but people already who have been under treatment for neck related issues, cervical spondylosis or other small disc bulges. So in such situations, first of all, the as I said, the precautions regarding the ergonomics, the chair position or the table position, they should all be adhered to. Neck, as we just discussed, break should be adhered to. Those guidelines do remain. But of course, the most important thing that we recommend for any patient with presenting with cervical spondylosis are the regular neck exercises. So the neck is fairly supported by a combination of what we call as the paraspinal muscles, which are the muscles on either side of the neck bone, as well as the trapezius, which sort of supports the entire upper back as well as the shoulders. So the neck is supported dynamically by these large muscles, and regular physiotherapy for the neck. There are a set of exercises, including the strengthening exercises of the paraspinal muscles, as well as the range of motion exercises, where we do. There's no strength training; it's more of a mobility training of the for the neck and the shoulder exercises. So especially the trapezius strengthening exercises. So these are the set of exercises which we do recommend to patients presenting with cervical spondylosis. So when we do have jobs where we need to sit for long hours and we do fatigue these muscles too, it is of utmost importance that we consider these physiotherapy, exercises, give the exercises utmost importance, so that our muscles are strengthened and in the right way. So I would say I usually recommend to the patients that routinely we ask them to do these exercises at least twice a day, so once in the morning and once in the night time. But when our job is such that we need to sit for long hours, I do say that at least once or twice during the day too, especially when they are taking a break, it's reasonable to go ahead with these, at least one round with of these exercises, because they do make a lot of patients, in fact, once they start doing it as a routine, they do feel that these exercises themselves act as pain killers, during the day. So if they're feeling fatigue, they do, some stretching exercises for 5 minutes to 10 minutes. I mean, even though they are maybe at the office, not feeling shy to do them in their seats, they do have a good relief of pain too, and in the long run, it definitely helps them more. So I say physiotherapy is of importance. The exercises are of utmost importance in a person who already has a cervical problem. Apart from that, there are other treatment modalities too. Some may require call-up, some may require additional physical therapy, or some may require some medication. So I would say that those should be taken care of after visiting the medical professional if they continue to have pain despite exercise.
And doctor, how helpful are the massagers to help people in relieving the pain? There are a lot of massagers that are available. When you talk about exercises, I think a lot of people rely on these massagers also to bring in some relief, which is going to help them. Like neck massages are there, or different sort of massages are there. So, would you recommend them to people?
Um, as I said, based on the evidence that we have, in the long run, the best support or best improvement of the spine health is attained by regular exercises, active exercises with the patient, and strengthening of the muscles. So that has the best long-term outcome. Secondly, as we talk about spine health or the neck health, good food habits, they do play an important role. We may discuss that later. So I mean, regular food habits, and then especially taking care of adequate amounts of calcium and vitamin D being a part of our diet. So those do help with the neck health. Third, we unusual habits that we may have, in terms of unusual work timings and erratic pattern of work. So these may harm our spine health. So these are three things which definitely do help with our spine health in the long run. Apart from that, as you said, massages. Those are, or there are other modalities which we call as physical therapy, like shortwave therapy or interferential therapy or TENS. So those are ways by which we can, a patient with neck distress, they can contribute to, they do relax the musculature around the neck, and they may sort of temporarily help with the inflammation. As an adjuvant modality, they can have some effect temporarily reducing the pain or making things better. In terms of the massages, I would recommend to only strictly adhere to or consult well trained people. There are a lot of neck massages. I have had patients in the past who had developed neck disc prolapse in the neck just because of careless massaging sessions. So such sessions may definitely need to be avoided. But some well-trained, masseuse can relieve us of some superficial pain. They are not going to change or directly treat the cause of the neck pain or neck discomfort, but they can give a temporary relief, and anything external is not dangerous for the patient. So reasonable massage sessions can be helpful. They may not really reverse the cause of the pain, or they may not provide any long-term advantages, but it can be helpful in making the patient more comfortable.
Right. So thank you so much for that, doctor. Doctor, the last question for the day is, how do stress and mental factors contribute to the neck pain in the workplace, and what strategies can employees use to manage stress-related tension in the neck?
Yeah. That's another important cause. A lot of times, the neck pain is not only from the neck. So, as I said, shoulder pain can contribute to tension in the trapezius. That can also cause pain in the neck region. A lot of times, a headache, migraine-related pain or stress-related headache, tension headache, as we call, they can also cause pain. A lot of pain in the neck, the pain in the upper back region. A condition called as fibromyalgia, which is related to chronic stressful conditions that can also lead to pain in the upper back and the neck. So definitely stress is one one particular factor which does cause neck discomfort and tightness around the neck. I especially in the workplace, apart from the postures and other physical things that we discussed, this may contribute significantly to a patient's symptoms. As I said, taking regular breaks may help. In addition, I would say options such as meditation or regular yoga can be quite helpful, or other stress management technique can be helpful in reducing whatever contributions the stress has been making to these symptoms. Right? In a lot of occasions, the stress may not be the entire cause for all these or the pain, but stress sort of worsens or increases the symptoms. That portion of the symptoms can be improved with regular stress management programs, whatever suits the patient. And of course, the patient should also be aware that there may be some physical reasons to, as I said, arthritis or spondylosis or discs, which may be which may actually be the underlying cause of the pain. So it should be a combined way of handling these stresses. So that definitely can help in improving the health of the person, especially in the workplaces.
Right, right. Thank you so much for sharing that, doctor. I'm sure this is quite helpful for a lot of people who are listening right now. So, guys, if you have any questions around your neck health, you can ask us in the comment section below, and we will try to take them up and ask the doctor about your answers to your queries. So, thank you, Dr. Vibu. This has been a very enlightening session. A lot of people have benefited from it. Wish you a very, very great day and a very, very happy weekend, doctor. And we look forward to connecting with you.
Thank you very much. It was a pleasure meeting you all. Thank you.
Thank you. Thank you so much. So, guys, this was Dr. Vibu Krishnan, orthopedic and spine surgeon at prestigious Dr. Devadas Hospital in Madurai. And we spoke about a very important topic on occupational neck discomfort. So, if you have any other topic which you want us to cover, please do mention in the comment section below. Let us know in the comments that what do you want to listen and how beneficial was this session. We have got multiple massagers on Cureka.com and multiple pain relief products that are available, which you can utilize and reduce your discomfort. If you want to check with the doctor, we have got in-house doctors which you can check with the help of free of cost WhatsApp platform. So do give us an opportunity to serve you, and we are looking forward to welcoming you on Cureka.com. So give us an opportunity to provide a product and a service to you, and we'll be more than happy for that. So thank you so much, guys, for connecting with us today, and wish you a very, very happy weekend. Take care until next time. This is your host for today, Rahul Nanuhal, signing off. Thank you so much.